After studying this module, you should be able to understand the micro skills of counseling, know about the skills of an effective counselor, learn the self-care skills, analyze attending skills, evaluate non-verbal communication of others. Let me first come to the introduction of this module. In the previous module, we discussed the affective skills of a counselor. In the next module, we will discuss the behavioral skills that an effective counselor should exhibit. First, let us outline a profile of an effective counselor. An effective counselor should possess a strong interpersonal skills including patience, warmth, caring, a sense of humor and friendliness. An effective counselor should be genuine and authentic, provide appropriate feedback and acknowledge his limitations. He should be emotionally mature and stable. He should be self-aware, possess positive self-esteem. He should be able to understand complex thoughts and use his training effectively. He should practice ethical and objective behavior, and he should be clear and effective in his communications. Counseling skills are also referred to as micro skills. Any therapeutic relation starts with the development of a good rapport with the client. Rapport can be understood as a harmonious relation that develops during the initial contact with the therapist, and it is established further in the counseling process. These skills are a set of verbal and behavioral responses that help develop rapport regardless of the counselor's theoretical school of thought and training. Some of these are basic, which relate to non-verbal behaviors, and some relate to listening abilities of a counselor, and some others are also linked to the response skills of a counselor. Now let us understand some basic behavioral skills of a counselor. First of all comes the self-care skills. The physical and mental health of a professional is also significant. A healthy counselor can be a model for good emotional and physical health. Self-care skills can help a clinician remain grounded and happy. Self-care is usually personal and depends on one's set of beliefs. However, in general, self-care is discussed under the topics of self-exploration and awareness, relaxation and centeredness, personal habits, relationships, and recreation. Let us first discuss self-exploration and awareness. If the counselor is self-aware and emotionally strong and stable, it can help deliver good treatment and prevent burnout. Various difficult situations arise during the counseling process, and the counselor needs to maintain self-esteem and efficacy to face these challenges. Self-exploration helps the clinician become more aware of their own values and cultural sensitivity. Counselors can achieve self-exploration through their own personal therapy or counseling, inner work, and meditation. In some schools of thought, such as psychoanalysis, it is mandatory for the counselor to also undergo therapy. This helps resolve his own conflicts. Another way to achieve self-awareness is by working on their own selves or inner work. This exploration can be done through reading, journaling, and dream work. The therapist needs to explore his life, relationships, past conflicts, feelings, beliefs, behaviors, etc. The term journaling has been used here. Journaling refers to writing about stressful life events and the deep feelings that surround this. It helps enhance mood, increase coping ability, and promote better physical and mental health. Meditation touches all aspects of life. Meditation helps one achieve inner calm and peace. It makes one's mind and senses more active and powerful. It reduces self-centeredness. It also connects the body, mind, and soul. It creates a harmony in the body and the mind. Apart from self-care and self-exploration, non-verbal communication and listening skills are also referred to as attending skills, and these are also significant. Attending skills are important in establishment of therapeutic rapport. Attending to the client refers to focusing attention on the client's verbal and non-verbal exchange during the therapeutic session. Clinicians need to develop these skills through training. A. Nonverbal communication. What is nonverbal communication? Nonverbal behavior needs to be picked up as expressed by the client. In addition, clinicians also use nonverbal cues to communicate various messages to the client. Nonverbal behavior may show client's messages which he or she is not able to communicate directly. Knapp in 1978 suggested 6 ways in which verbal and nonverbal communication can interact. First means of interaction is repetition or confirmation. The nonverbal message confirms what is being said verbally. The second is contradiction or denying or confusion. It is that nonverbal communication is in contradiction with what is being verbally said. Then the clinician can help pick up these cues as crucial to work upon. A third is substitution. Nonverbal expressions are used to respond to a verbal question. Another use is complementation or strengthening of any verbal response. Fifth interaction is called as emphasizing or accenting. In this, the nonverbal expressions highlight only certain aspects of verbalization which is of significance to the clinician or the client. Finally, the sixth use is regulation. These are expressions which control the flow of communications such as when to talk, when to stop, etc. There are certain components of non-verbal communication which include number 1, the physical appearance. Physical appearance refers to the physical body of the person, including his clothing, grooming and hygiene, manner or style of dress, eyes and hair color, complexion, level of physical fitness and physical attributes such as scars, bruises, physical handicaps and prosthetic devices. Some of these describe the client and others can be interpreted as forms of nonverbal communication. Hygiene and grooming is judged to check if it is appropriate to the societal and cultural norms, health standards and some extent of mood levels. These are indicators of client's social competence and judgment. Appearance of the clinician is also a significant factor. Clinicians wearing expensive jewelry while working with poor or homeless clients, or wearing a tight skirt and heels when working with children in play therapy may not be appropriate. Clinicians need to be sensitive to these factors. Also, wearing dirty or revealing clothes is not appropriate. The next factor under nonverbal communication comes is kinesics. Kinesics involves movement or body part or as a whole. Head, face, eyes, mouth, shoulders, arms, hands, legs, feet and torso are some parts significant in nonverbal communication. They indicate about a client's health, alertness and moods. Diagnoses such as delirium, dementia, etc. are linked to alertness. Depression, elevated mood, bipolar are also related to body movement. Other body movements observed are agitated, fidgety, unusual, normal, tics, tremors or motor abnormalities. Some autonomic responses are also observed such as breathing rate, blushing or paling, pupil dilation, etc. All of these movements need to be evaluated for congruence with the verbal content or expression of the client. Here, eye contact is especially significant. Even though there is some common understanding of the nonverbal gestures, but each client may be different in the use of these gestures. The client needs to be careful to make evaluations based on the context in which these behaviors occur, including the culture and gender. Hence, enormous information can be gathered from the way client uses his body. The table mentions some common possible interpretation of kinesics. The table first discusses the body part, the second column discusses the non-verbal expression, and the third column mentions the possible interpretations. Coming to the first body part is eye. Any expression of the eye which shows direct eye contact can be interpreted as attentiveness, readiness for communication. If the eye contact shows a lack, it could mean withdrawal, avoidance for communication. A looking down behavior may show preoccupation, avoidance, or concentrated thought. A stared or fixed eye gaze can mean preoccupation, uptightness, rigidity, psychosis. Darting eyes or blinking could mean anxiety, paranoia, excitement, or dry contact lens. Squinting or furrowed brow can mean thoughtfulness, concern, or annoyance. Teary eyes could mean sadness, happiness, frustration, anger, or fear. A dilated pupil could mean alarm, interest, or under the influence of drugs, and eyes which are moving to and away from contact could be recalling a memory or an interest. These are possible meanings. Now let us come to the next body part and its meaning, mouth. Smiling lips could mean greeting, positive mood, avoidance, or denial. Tight lips could mean stress, anger, hostility, concentration. Quivering lips could mean sadness, anger, crying, anxiety. Biting or chewing lips could mean anxiety, bad habit, and an open mouth could mean surprise, boredom, and fatigue. Coming on to the facial expressions, a flushed face could show embarrassment, anxiety, or surprise. Eyes which are wide and mouth wide open could mean startled or sudden insight. Eyes looking up and mouth pursed could mean memory retrieval, disagreement, or thoughtfulness. Now understanding the meaning of head movements. Nodding up and down means agreement and attentive. Shaking left to right means disagreement and disapproval. Hanging the head down could mean sadness, hopelessness, and tilting the head to one side could mean listening and paying attention. Now understanding the movement of shoulders and neck. Shrugging of shoulders could mean uncertainty, ambivalence, indifference, or sadness. Slouched shoulders could mean sadness, withdrawal, shyness, and bad posture. Raised shoulders could mean self-protection, stretching, and neck rolls could mean tension, stretching. Arms and hands. Folded arms could imply close to contact, dislike, or barrier to contact. Trembling hands could mean anxiety, anger, or disease. Clenched fist could mean anger, resistance to disclosure, intimidation, bad habit. Open gesturing could mean openness to disclosure, willingness to contact, and stiff or unmoving hands could mean anger, anxiety, shyness, or sore muscles. Legs and feet. Crossing or uncrossing of legs could mean anxiety, nervous, depression, self-protection. Foot tapping could mean anxiety or impatience. Now the whole body movement. If the whole body is leaning forward, it could mean attentiveness, interest, openness, connectedness. Leaning away or leaning back could mean withdrawal, rejection, interpretation, or relaxation. Turned to one side could mean avoidance, fear, or expectation of rejection. Rocking or repetitive movement could mean anxiety, worry, or bad habits. And habitual movements like tapping or hair twirling could mean concentration, boredom, anxiety, impatience, and bad habit. Now let us come to understanding the breath of the person. If the person is taking slow and deep breathing, then it could mean relaxed or attempt to calm, comfort and good breathing habit. If the person is hyperventilating, it could mean anxiety, panic, loss of emotional control. If the person is under breathing, it could mean anxiety, depersonalization, or if the person is short breathing, it could mean anxiety, depression, poor breathing habits. Hence, to understand the client's communication completely, the clinician needs to keenly focus on the client's nonverbal expressions. It is important to know and read the client's expressions, to know the issues on which client places significant emphasis. Clients also make assumptions about clinicians' nonverbal expressions. Thus, the clinician needs to be self-aware about the messages he might be communicating to the client. Now, let us come to the next understanding of nonverbal communication, that is the paralinguistics. Several other aspects of speech such as voice, volume, pitch, speech fluency, rate of speech and pattern of speech also have great communication value. The therapist needs to carefully attend to the client's volume and whether this changes or fluctuates with the client's change in topics. For example, high volume may show anger, whereas low volume may indicate sadness. A high-pitched voice may indicate anxiety. Changes in inflection may be related to touchy topics. Speech fluency, speed, clarity and errors should also be noted. Stuttering while discussing particular topics also indicates discomfort or conflicts in those areas. Hesitation or break in fluency may indicate reservations about self-disclosure. Errors in speech, inability to articulate using right words, may suggest anxiety or resistance. Rate of speech simply means the speed at which the client communicates, simply seen as the number of words spoken per minute. Thus, it can be slow or fast, but also varies from culture to culture. In addition, the clinician needs to observe change in speed with respect to a client. When there is a change in this general nature of speech, then it needs to be noted and explored. In addition, one may explore if there is a change in the rate of speech over a longer period of time. Patterns of speech relate to other aspects in speech such as silences, pressure, accent or other expressions such as voice breaking, gasping, sighing, etc. Sudden stopping or silence may indicate confusion, despair of sudden insight. Pressured speech may indicate agitation or restlessness due to anxiety, anger and excitement. Trying hard to breathe or shortness of breath may show the onset of panic. Sadness is shown in break of voice and sighing may show boredom, disinterest, discouragement or relief. The clinician has the task to make accurate observations for correct interpretations. After a good rapport is formed with the client, the clinician develops a baseline patterns for nonverbal expressions of the client, and any deviations from this pattern is carefully observed. A self-aware clinician can use his vocal abilities to communicate effectively with any client. The practice and training to use paralinguistics help complement and accentuate the messages communicated by the client and the clinician. The clinician needs to constantly adapt voice quality to match a particular client's behaviors for a good rapport. The right use of paralinguistics can be powerful therapeutic intervention. For example, a client who speaks fast can be dealt with clinician modeling a relaxed and calm rate of speech. For ethnic groups, the clinician can slow down his speech for greater understanding by the client. Next comes the use of space. A lot of information can be gathered from the way the client uses personal and environmental space. Distance and space are factors observed for space utilization. The space between the client and the clinician is crucial. Some clients may feel extreme discomfort with the chair close to the therapist. Others may feel comfortable with the chair quite close to the therapist. The appropriate distances of personal space also differ according to culture and gender. However, there arises a conflict in the differences in the need of personal space of the counselor and the client. Hence, the clinician needs to be sensitive to the need of the client and work accordingly. It will also depend on the workspace available. It should be clutter-free and heavy furniture should be avoided. A significant factor related to personal space is touch. Touch carries different meaning in different contexts and different relations. In a particular context, touch may be caring response. In others, it may be a violation of space and have negative consequences. The clinician should refrain from any such kind of touch. In addition, other factors such as positioning of the desk between the clinician and the client can also be used to create personal space. When there is a need for emotional sharing, face-to-face or side-by-side seating can be used. One final non-verbal communication emphasized here is timing. Timing refers to all time parameters of the session, such as initiation and finishing of the session and appropriate use of time within the sessions. It is a pact between the counselor and the client as to who speaks when. The clinician should practice and train oneself in appropriate use of time. For example, if the client stops his talk, it is the task of the clinician to use the right phrases and questions to start the communication again. The clinician evaluates the appropriate time for self-disclosure and helps client to do so. It may be an attempt by the client to extend the session. The right use of timing helps develop personal and therapeutic boundaries. Usually, these issues are sorted out in the first session only, wherein the clinician clearly and verbally states the boundaries for himself and the client. A very significant of all behavioral skills, namely listening skills, will be addressed in the next chapter. Let us summarize what we have learnt in this module. Counseling skills are also referred to as micro skills. Any therapeutic relation starts with the development of a good rapport with the client. Rapport can be understood as a harmonious relationship that develops during the initial contact with the therapist, and it is established further in the counseling process. These skills are a set of verbal and behavioral responses that help develop rapport regardless of the counselor's theoretical school of thought and training. Self-care skills are significant behavioral skills which relate to the physical and mental health of the professional. A healthy counselor can be a model for good emotional and physical health. Self-care skills can help a clinician remain grounded and happy. Self-care is usually personal and depends on one's set of beliefs. However, herein, general self-care is discussed under the topics of self-exploration and awareness, relaxation and centeredness, personal habits, relationships and recreation. Another significant behavioral skill is attending skills. These are important in the establishment of therapeutic rapport. Attending to the client refers to focusing attention on the client's verbal and non-verbal exchange. Clinicians need to develop these skills through training. The non-verbal behaviors that need to be observed and picked up are expressed by the client. In addition, clinicians also use non-verbal cues to communicate various messages back to the client. Non-verbal behavior may show client's messages in which he or she is not communicating directly. The topics discussed for these are physical appearance, kinesics, paralinguistics and use of space and timing.